Welcome to Ulosca channel. Access all nursing practice questions. Advanced pharmacology across the lifespan practice questions with answers.
Question 1. Which pharmacokinetic change occurs in the elderly and affects drug distribution? A. Increased hepatic metabolism. B. Increased body fat percentage. C. Increased renal clearance. D. Increased total body water. Which one is the correct answer? The correct answer is B. Increased body fat percentage. Explanation. Aging leads to an increase in body fat and a decrease in lean body mass and water, which affects the distribution of lipophilic drugs and can prolong their half-life. Question 2. A drug that binds to a receptor and activates it is called A. Blocker, B. Antagonist, C. Agonist, D. Inhibitor. Which one is the correct answer? The correct answer is C. Agonist. Explanation. An agonist activates a receptor to produce a biological response, while antagonists block the receptor. Question 3. Which medication is considered safe during pregnancy? A. Levothyroxine. B. Warfarin. C. Isotretinoin. D. ACE inhibitors. Which one is the correct answer? The correct answer is A. Levothyroxine. Explanation. Category A. Drugs show no risk in controlled human studies. Levothyroxine is a naturally occurring hormone replacement and considered safe in pregnancy. Question 4. A pediatric dose of medication is most accurately calculated based on A. Age, B. Body weight, C. Height, D. Body temperature. Which one is the correct answer? The correct answer is B. Body weight. Explanation. Children vary widely in size and development, so weight-based dosing is more accurate and safer than age-based estimates. Question 5. Why are neonates at increased risk for drug toxicity? A. Increased protein binding. B. Immature liver and kidneys. C. Increased gastric acid. D. Enhanced enzyme activity. Which one is the correct answer? The correct answer is B. Immature liver and kidneys. Explanation. Neonates have underdeveloped liver enzymes and immature kidneys, reducing their ability to metabolize and excrete drugs effectively. Question 6. When prescribing antibiotics to a breastfeeding mother, the nurse practitioner should A. Avoid all antibiotics. B. Use high doses to ensure effectiveness. C. Choose drugs with low excretion into breast milk. D. Recommend stopping breastfeeding. Which one is the correct answer? The correct answer is C. Choose drugs with low excretion into breast milk. Explanation. The goal is to use antibiotics that are effective but have minimal risk of transferring into breast milk and affecting the infant. Question 7. Which of the following drugs requires therapeutic drug monitoring due to its narrow therapeutic range? A. Ibuprofen. B. Metformin. C. Digoxin. D. Lisinopril. Which one is the correct answer? The correct answer is C. Digoxin. Explanation. Drugs like digoxin have a small margin between therapeutic and toxic levels, requiring careful monitoring to avoid adverse effects. Question 8. In older adults, the most significant pharmacokinetic change is typically seen in A. Absorption, B. Excretion, C. Metabolism, D. Distribution. Which one is the correct answer? The correct answer is B. Excretion. Explanation. Excretion via the kidneys decreases with age due to reduced renal blood flow and glomerular filtration rate, increasing drug half-life. Question 9. What is the primary concern when prescribing benzodiazepines to elderly patients? A. Increased risk of falls and confusion. B. Excessive salivation. C. Skin sensitivity. D. Weight gain. Which one is the correct answer? The correct answer is A. Increased risk of falls and confusion. Explanation. Older adults are more sensitive to CNS depressants, increasing their risk for sedation, falls, cognitive impairment, and injury. Question 10. Which statement is true about prescribing medications across the lifespan? A. Children and older adults often require dose adjustments. B. Adults metabolize drugs slower than elderly. C. Drug absorption is faster in infants. D. All drugs are equally effective at all ages. Which one is the correct answer? The correct answer is A. Children and older adults often require dose adjustments. Explanation. Children and elderly often require adjusted doses due to organ immaturity or decline, affecting how drugs are processed in the body.
Thank you for watching. For more practice exam questions, subscribe to our website at www.ulosca.com.